We've been hearing a lot about consolidation and sharing of services to cut costs. The two largest hospitals in the region are teaming up when it comes to caring for heart patients. We are joined by the CEOs of both CVPH and Fletcher Allen Healthcare, Stevens Mundy and Dr. John Brumstead. Welcome to you both. Nice to have you here.
Thank you, Tom.
What exactly is changing between the two hospitals when it comes to care for heart patients?
What we're doing is looking regionally at how we can provide access to the highest quality, most efficient care across the board. That's really the cornerstone of our hospitals coming together to form Fletcher Allen Partners. And we really have looked at where we can provide the highest quality and do it most efficiently. And I'll let Stevens talk to some of the specifics about how that's all coming together.
You know, over the past couple of years, we've seen our cardiac surgical volume to be in the 110 to 100 cases, and really is not sustainable at that level. At the same time, we've seen an increase in the number of angioplasties, the number of other invasive cases, electrophysiology, to where we're doing 1,400 of them. So it's a very dynamic, growing service, and with that, as we looked at it, it didn't make sense to continue to provide that service. And knowing that our volume is going down, at some point you're going to say your staff competencies, you know, the training that people need, you know, you can't do drills and things like that to simulate everything. And we were in a position of where we said we need to make this decision, as difficult as it is, before we have an untoward event. That we really want to focus on high quality. We do a tremendous job with angioplasty, and we wanted to grow that.
And so that continues, the angioplasty. Your catheterization lab has grown or expanded 2 or 3 times over the past decade or so.
Yeah, we started off with 1, then we had 2, now we have 3 cath labs, 2 dedicated to angioplasty and cardiac cath from a diagnostic standpoint, and 1 dedicated toward electrophysiology, pacemakers, implantable defibrillators, et cetera. And with that, we're doing almost 1,400 now. So it's that's a lot of procedures.
There's another really important point here, Tom. For a number of years, CVPH and Fletcher Allen were in competition over heart care, and we had folks from northern New York that were going past the excellent cardiac catheterization services at CVPH to come to Fletcher Allen. And part of what we're trying to do with Fletcher Allen Partners is to keep the care as close to home as possible, as long as we can maintain the quality and the efficiency. So as part of this, some heart surgery patients will come from northern New York to Fletcher Allen to a consolidated program, but many more of the folks that need cardiac interventions that can be done in a cath lab that come from northern New York will be able to get that done on this side of the lake, so closer to home.
So that stays and expands even more?
It expands.
You're looking at about 100 cases that we were doing from a home and heart standpoint. It was less than 100 last year. That will now be done in Vermont. There are probably 200 interventional cardiac procedures, angioplasties, cardiac caths, et cetera, that were done in Vermont on patients from New York. And we'll see those switch. So essentially over time you'll see less patients traveling. You know, there's higher quality, better access, and that translates to people staying closer to home.
Now, you mentioned the 100 cases or so. What type of surgeries are we talking about that will now shift to Fletcher Allen?
We're talking about all of the open heart surgeries, the classic where they work on blocked heart vessels, as well as valve replacements. Those will come. And you know, it's important also to emphasize that with folks taking better care of themselves, the type of drugs that lower cholesterol and whatnot, overall the number of open heart cases nationally have been declining. So it's important for this region to have a cardiac surgery program that has enough volume to maintain that quality, and that was part of the conversation as well.
A lot has really changed over the past decade or 2 decades. A lot less invasive open heart surgery now is being replaced by the surgery where they can go through an artery, and not all of it, but more and more.
As a matter of fact, there is a national clinical trial that's ongoing at Fletcher Allen UVM right now with the replacement of the aortic valve, one of the major heart valves, that can be done actually in the cath lab. Now you need to have the full backup of the cardiac surgery team there, but it's another example of moving towards more minimally invasive procedures for heart care rather than having to do a major open heart operation.
And were you going to say
I think it's important with that. That probably represented 20 to 25% of the cases that we did at CVPH, and if those procedures went from an open procedure, a surgical procedure, to one that's done through the cath lab, that further decreases the number of cases in our operating rooms, and the quality is shown. There was a recent study that came out, New England Journal of Medicine, that it was at least as good, if not better, the outcomes, and the mortality was lower. That's how you want that procedure to go, just like other procedures have gone to minimally invasive, and it further cemented in my mind the correctness of the decision we made.
How does this change the heart unit at CVPH, though? Does this eliminate a number of cardiologists, healthcare workers? Are you seeing a number of positions lost?
I think that actually the number of cardiologists, so those that perform angioplasty, cardiac cath, will continue to grow as we keep more patients in this area. We've got a couple of physicians right now from Vermont who've applied for privileges at CVPH, and we've got one. I think one of the cardiologists supposed to start over here in the next month or so. Those are exciting things. Dr. Ann Cahill, who performed open heart surgery, also performed a lot of thoracic surgery, which is lung surgery, et cetera, and kind of reflects some of the health statistics we see, that we have a large incidence of lung cancer, et cetera, in our communities, and there's unfortunately still a strong demand for that. And she loves this community, is going to stay here and work with us in our thoracic program.
Other positions, though?
There were, I think, a total of 4 positions that were eliminated, and the people didn't find jobs within our organization. But there were probably 8 positions where people did find jobs within our organization, other open positions, and we worked very, very closely with them. So out of 12, I think 4 didn't find positions in our organization.
Cost savings?
Over 5 years to our system of care, and so that includes all of Fletcher Allen Partners, Central Vermont Medical Center, Fletcher Allen, CVPH, and Elizabethtown. We project between $20 and $25 million worth of savings over those 5 years by moving the cardiology and cardiac surgery cases.
And as you mentioned, a few years ago, these hospitals, your hospitals, would be competing, offering many of the same services.
Right.
That's no longer the case. You really have to look at these partnerships now to cut cost and just to stay operating.
Well, and that's at the core of why we brought Fletcher Allen Partners together, why we've brought these healthcare organizations together, so that we can take a regional look at how care is delivered, where it's delivered, when it's delivered, who's delivering it. And we want to balance a number of factors. We want to keep care as close to home as possible. We absolutely always want to maintain the highest quality. It needs to be efficient. In the era of healthcare reform, we know that healthcare has been too expensive and reimbursements are going to be very constrained. And so to keep available for the folks of the North Country and Vermont the services that we want, we had to come together and do things differently. So it's really at the core, and a great example is cardiac care, and there'll be other such examples in the future.
And you had mentioned this started in 2012. You teamed up with the Central Vermont Medical Center.
Yes.
Then Fletcher Allen and Elizabethtown came on board. In what other areas with this partnership are you sharing services and consolidating services and cutting costs?
I think one of the best examples right now I would look at is the family medicine residency that we're working for. Dr. John King was head of the family medicine residency in Milton, Vermont. And after a lot of discussion and realization of the need in our whole North Country, not just the Plattsburgh area, but the whole North Country for primary care physicians, we decided to move forward with that. And he's been working with us for the past year on developing a family medicine residency. We're now in the position of recruiting a director for that program. It'll have 12 residents. So, those 12 more than compensate. That's just the physicians. You probably got 2 staff members for each resident, I would think, somewhere between 1 and 2. So we're creating jobs with that, but more importantly, we're creating access to primary care and we couldn't do this alone. It's clearly something we looked at over the years and could never figure out how to do it. It's been the support from Fletcher Allen Partners, from the University of Vermont, to get this off and running, from New York State now. They're tremendously excited about this.
And having the doctors over here, third-year students doing residency over here, in many cases, do those doctors then stay in this area? And so does this start to tackle that problem you're talking about the shortage of primary care
physicians? The statistics,
physicians?
particularly for primary care residencies like family medicine, are pretty startling. It's 60-70% of the graduates stay within a very short distance of where they train. So this really will be a feeder for the North Country. It has been for the family medicine residency in Milton. A lot of those folks have stayed in, some in northern New York, but the bulk in Vermont. So it's really a real positive.
And are there other areas you're looking at consolidation or partnerships in any other type of?
Just in our purchasing so far, we've really worked very closely between the various organizations to try and reduce our costs, to purchase from similar vendors and to gain those economies of scale, just like other organizations do. I look at the colleges. The colleges benefit in our region from being part of this SUNY system. They get serious purchasing power from that, and we're gaining more and more and more. And as other organizations come into the system, our ability to do that grows even more.
It's really amazing that very early on in our relationship, really CVPH and Elizabethtown have been part of Fletcher Allen Partners just a little bit over a year. January of 2013 is when this all came together. We made tremendous progress in cardiac care, as we've been talking about. We're having conversations in a number of different areas as well. Those conversations are early. They're in things like radiology and laboratory medicine and endocrinology, which is hormonal treatments and diabetes. And those are all conversations that, again, are based on trying to find the best way to deliver care for our region. And I have every confidence that those physicians and other providers are going to come together and figure out how to provide excellent service to folks at the North Country.
And do you look beyond this point to include other hospitals, in New York, Alice Hyde, Adirondack Medical? Do you look to widen the network in Vermont, Porter, or any other of the other hospitals relatively close to you?
We're having conversations with some in Vermont, and on both sides of the lake, we've brought together networks of providers in what we call accountable care organizations. And so there's ways other than Fletcher Allen Partners that we're relating to others. We are having some conversations, although they're preliminary, with folks in the North Country as well. What we want to avoid is just building a system for building its sake. We're really looking at bringing on partners if together we can bring increased value to the communities that those folks are serving. And we're having good conversations that 5 years ago I never would have imagined that we would have.
So heart patients will be able to see their cardiologist at CVPH. They won't necessarily need to see a new doctor.
That's correct.
They can keep their current cardiologist. What are you hearing from patients and their families, though? Is this an inconvenience for them, or is there some unhappiness about having to now go to Fletcher Allen for surgery?
It's interesting. You kind of hear both. We've got people who say, "What a great decision," and they're very appreciative of the leadership that we've shown in making the right decision. I've had some people express concerns about traveling, but I've also had people express gratitude at having not to travel anymore. Some of those that went from other areas because of past physician relationships and are now able to stay in New York because we're not functioning as competitors. So I'd say that if you kind of balanced everything out, it's probably 3 to 1 from a positive standpoint.
I'd also point out that we're working hard to have the cardiac surgeons from Fletcher Allen come to CVPH in Plattsburgh to do the preoperative and the postoperative care. Obviously, when somebody's in the hospital, it'll be at Fletcher Allen, but beforehand and afterwards, the surgeons will be coming to the patients.
And there certainly was a time when patients had to travel for heart surgery, either St. Peter's or Albany Med or Fletcher Allen or beyond.
Well, I think if you look at it at that time, look back 7, 8 years ago, they had to travel for angioplasty. So the 700 or 800 patients that have angioplasty and the 100 open hearts, 800 or 900 people traveled. And when we started that program, you couldn't do angioplasty without an open heart surgery on campus. And those days are long gone. There's 7 or 8 freestanding angioplasty programs in New York and more coming. It's something that's not needed. And so we've really, I think, done a tremendous thing for our community with the programs we're developing.
All right, Stevens Mundy, John Brumstead, thank you very much for taking the time. We appreciate it.
Thank you, Tom.